Class, welcome back. It's Dr. Lindner. Let's take a look at some of the things that can influence the structural integrity of bone. Exercise, hormones, and nutrition, all equally important in maintaining the integrity of bone. So normal bone growth and maintenance depend on nutritional and hormone factors. Let's look at some of these nutritional factors. Vitamin C is very, very important. It's required for collagen synthesis and to stimulate osteoblast differentiation. Osteoblasts with a B build up bone. Osteoclasts with a C break down bone. B for build, C for see you later, they break it down. Remember that collagen makes up somewhere between 30 and 33%. So at least 1/3 of the bone is collagen. Okay. Vitamin A is needed. Vitamin A is needed to stimulate osteoblast activity. Vitamin K and B12, these are needed to synthesize bone proteins. One of the biggies, especially with vitamin K, it's called matrix GLA protein. Some call it GLA matrix protein, some call it matrix GLA protein. But what this matrix GLA protein does, is it takes calcium and drives it into the bone. Okay. Vitamin D, vitamin D is needed to absorb calcium. So you've eaten food with calcium, and vitamin D is needed to pull it out of the digestive tract into your circulatory vessels, into your blood circulation. But vitamin K is needed to stimulate matrix GLA protein that drives that calcium into the bone. That's why people that take vitamin D without vitamin K, they get vascular calcification, meaning their blood vessels calcify because they never stimulated matrix GLA to get the calcium out of the blood vessels into the bone. This happens to a lot of people who are on statins for cholesterol, like simvastatin, arvastatin, Lipitor, Crestor. These statins happen to block vitamin K. So they still have vitamin D, they can still get calcium, but unfortunately, the calcium starts to accumulate in the blood vessels. And when blood vessels calcify, you get an increase in blood pressure. An increase in blood pressure damages the endothelial lining, the internal lining of your blood vessels, and then the body produces cholesterol to fix that. It's a horrible cycle. Many people end up having to go for open heart surgery and quadruple bypass surgery as a result of them. The statins tend to stabilize the plaques. That is for sure. They can stabilize any unstable plaques to try and prevent stroke. So there is some good in that. We have growth hormone and thyroxine, which is T4. They stimulate bone growth. The sex hormones like estrogen and androgen, they stimulate again osteoblasts, which build bone. And calcitonin and PTH is parathyroid hormone, they're going to regulate calcium and phosphate levels. So calcitriol, when we think of calcitriol, we're thinking vitamin D. The kidneys are involved in helping produce that. Of course, we do need UVB rays, and the UVB rays come down and they hit the subcutaneous cholesterol on the skin. Then it goes to the liver, and the liver makes the liver makes 25 hydroxide, and then it goes to the kidneys where it hydroxylates it again and makes 125 hydroxide. And that promotes calcium and phosphate ion absorption at the digestive tract. Growth hormone that's produced by the pituitary gland that stimulates the osteoblast activity and the production of bone matrix. Thyroxine, which is T4. T3 is called triiodothyronine, but thyroxine is T4. So with growth hormone, they work together to stimulate osteoblastic activity and produces the bone matrix. The sex hormones, estrogens that are produced by the ovaries and androgens produced by the testes, these two stimulate osteoblast activity and the production of bone matrix. And then we have the parathyroid and the thyroid. You have the parathyroid glands and the thyroid glands. So the parathyroid produces PTH, and the C cells of the thyroid gland produces calcitonin. Calcitonin's job is to try and decrease blood calcium, and PTH's job is trying to increase blood calcium levels. So it increases the calcium levels by stimulating osteoclast activity, which elevates the calcium ion concentration. In the thyroid gland, the C cells produce calcitonin. That's going to inhibit osteoclast activity. It's going to stop the breakdown of bone. Okay, it's going to inhibit the osteoclast activity, promoting. Now remember, the goal is we're trying to lose calcium. So hey, let's lose it at the kidneys. Let's lose it at promote calcium loss at the kidneys and reduce calcium ion concentration in body fluids. So we're basically saying we're trying to decrease the calcium levels. How do we do it? Let's try and get some of the calcium into the bone. How do we get it into the bone? Well, we're going to inhibit the breakdown of it. We're going to get rid of it by promoting loss at the kidneys. You'll urinate some of it out. And then we'll have vitamin D that's needed to absorb it and drive it into the bones. All ways of trying to decrease it. So PTH and calcitonin are working antagonistically. Okay, so we also have some of these minerals like calcium and phosphorus. Those are involved in producing the extracellular matrix of bone. Magnesium also involved in the extracellular matrix. Fluoride is needed to strengthen the extracellular matrix. And manganese, not magnesium, but manganese activates enzymes involved in the synthesis of the bone extracellular matrix. So in a lot of the bone formulations from a lot of nutraceutical companies, it's very normal to find those, especially manganese, and also boron. You'll start to read a little bit more about boron. Those are important minerals and even some trace minerals. The vitamins, we spoke about A for osteoblastic activity. We spoke about C for collagen production. We spoke about D, which remember we need UVB rays to come down, hit the subcutaneous cholesterol on the skin. Its first pit stop is the liver, and then it goes to the kidneys. And that's what makes the 125 hydroxide. But when you get your blood levels checked, we're checking what the liver makes, which is 25 hydroxide. Okay. And then vitamin K and B12, these are involved in the synthesis of bone proteins as well. Remember the GLA matrix or matrix GLA protein. You need especially vitamin K for that. And then the hormones, we have growth hormone that's secreted by the anterior lobe of the pituitary, and it promotes the growth of all body tissues, including bone. There's insulin-like growth factors that's secreted by the liver, the bones, and other tissues on stimulation by growth hormone. So they are linked together, and promotes normal bone growth by stimulating osteoblasts and increasing the synthesis of the proteins that are needed to make bone. T4, primarily T4 and T3. T4 is thyroxine that stimulates the osteoblasts. We have testosterone and estrogen. Those are involved in stimulating osteoblast and promoting bone growth. That's why during puberty, where there's an increase of estrogen and testosterone, we typically see those growth spurts that take place. Okay, somewhere between the ages of around 18 to 21, it starts to slow down a little bit. Okay, that's when the growth plates start to close just a little bit. And we spoke about PTH and calcitonin that work in opposite ways to regulate calcium balance. In terms of exercise, it's very important when you're younger to exercise to build up as much weight-bearing activity as possible and resistance training that puts tension on the muscles and tendons that pull on bones. Anytime there's stress on bones, they build up and get stronger. Even chiropractic adjustments put stress on those bones. They build up and get stronger. Walking, swimming, cycling, any type of exercise is better than none. Okay, they're going to increase and stimulate the osteoblast activity, helping to build thicker bone and stronger bone and slow down any type of bone loss. Tries to hold that off for as long as possible. There's a degree of bone loss that takes place, but it's this coupling between bone buildup and bone breakdown. Bone buildup and bone breakdown, they happen together. It's when there's the accelerated breakdown faster than the buildup that we have issues. Okay, and aging, as the level of sex hormones diminish during middle age to older adulthood, especially in women after menopause, bone reabsorption by osteoclast outspace the bone deposition by osteoblast. This is what we were saying, which leads to a decrease in bone mass and increase in osteopenia and osteoporosis. So this is why maintaining exercise is so important, especially for women as they get older. But it's not just the decrease in estrogen that does it. You need to have decreased estrogen with what's called an antigenic load, which means decreased estrogen in the presence of an antigenic load means you're putting stuff in your body that your body doesn't like, and it's rejecting it because that upregulates your immune system. And osteoclasts are a macrophage, which comes from white blood cells. And I'll show you that when I go over rank and rankle. If there's an imbalance in these hormones, we can have issues. So if there's an oversecretion of human growth hormone in the childhood, we have something called giantism. And if you have a growth of a growth spurt, or you have an increase in growth hormone in adults, it's called acromegalia. Okay, this is when you have like thickening of the skull bones, the jaw bone, when they look very Neanderthalic, very caveman-like. In an adult, that's acromegalia. When it happens in adolescence, it's called giantism. Now, if there's undersecretion, you have too little human growth hormone or too little thyroid hormone in childhood, then it creates what used to be referred to as dwarfism. It's not politically correct to use the term anymore, but short stature is what is utilized. And both men and women that lack estrogen receptors on the cells, they grow taller than normal. It's the estrogen that's responsible for the closure of the growth plates. So this is what short stature looks like. And this is what happens If you have too much, you get long, slanky type of structure, long, thin toes, fingers, humerus, all the long bones are much, much longer. Now, sometimes there are genetic disorders as well, like Marfan syndrome, which is a connective tissue disorder that affects elastin. Okay, and then you get the long, slanky extremities. The life-threatening part of Marfan's is in relationship to blood vessels, because elastin is a layer of the blood vessels, and if you lose the elasticity, blood vessels can rupture, and it could become life-threatening. This is too little growth hormone, and this is obviously too much growth hormone. Okay, when we come back, we'll get into the histology of bone.